So talk to me about medical conditions that may have an adverse effect or maybe make you less of a candidate. Talk to us about diabetes, or talk to us about different conditions that are metabolic in the body that may affect or may make you a better candidate or worse candidate for this treatment.
Amazingly, there's not a whole lot that affects it. So, especially if you know how to, as the practitioner, how to change your soup, for lack of a better deal, how to change the product to fit the patient. Diabetic patients do fine. The older you get, bone marrow concentrate, your stem cells get a little weary. But the thing that I found is that a 95-year-old just wants to play canasta. They don't want to go throw a 110-mile-an-hour fastball, right? So, I mean, who would love to do that? But, I think the bar is different. So for our outcomes, there's just as much patient satisfaction in an older person than there's in a younger person.
Well, let's talk about age. What is there too young of a patient or somebody that you wouldn't want to treat because of they're too young?
Well, there's really not too young, but normally it's that adolescent 12 years and older where you start looking at PRP, especially for things like Sever's disease, Osgood-Schlatter, things like that. So at that age, PRP is very safe. Normally, you don't need it younger than that, but you could theoretically treat someone younger. The bone marrow concentrate is something that's a little bit dicey until you've closed your growth plate. And that normally occurs, well, it depends, like about 17 for girls and a little younger for guys. So it just depends. So those are about the only people that I say that you can't really treat them. The other individuals that you can't treat are people with active cancer. So if you've been diagnosed with cancer and it's not been in remission for at least 2 years, we usually don't recommend it. And that's not based on studies from bone marrow concentrate or adult stem cell concentrate. That's based on the theoretical concern that we know we have embryonic cells, which are we call pluripotent, which means they can become anything they want to become. So if you inject that cell into a body, it can become a cancer cell if triggered by another cancer cell. So if you've recently had cancer and there's other cancer cells floating around, you don't want to give somebody cancer to make their knee better. But that's an embryonic cell. Adult cells, there's been no cause and effect, but we still are cautious. So if someone's had active cancer within 2 years, the other individuals you have to be careful of are individuals who are, let's say, they have had a recent stent placed and they're on Plavix or a blood thinner, and the cardiologist does not want them to come off it. So it's usually those things. But in general, there's no cut and dry except for really cancer, individuals with a chronically low platelet counts, people on Plavix. Those are sort of the big group of individuals you want to be careful of.